We're also going to be talking about NEMT call centers. So this has been a topic that has come up various times during the TAC sessions. We're going to kind of dig into them a bit more than we ever have before to learn more about sort of what are the OHA expectations, requirements, and reporting. We'll hear from call center manager to hear what it's sort of like the day to day and the things that they work on. And then we'll have a chance to really talk about sort of, your experience as whatever role that you're playing with NEMT call centers, and then do some brainstorming around what might make sense in terms of improvements. We'll have a chance to talk about OHP member informing materials, and we'll get into this a little bit more about exactly what that means once we get there. And then we'll have a wrap up to talk about sort of next steps coming out of this meeting. Anything that we need to do between now and the next meeting in July, and then be looking sort of forward. Our last meeting is scheduled for August, so I want to start talking with you all about what that might look like sort of post-August, and just get some initial ideas and thoughts. And we'll have more time over the next couple of meetings to talk more about that. So I think you can go ahead and go to the next slide. So these are kind of our standard intro, just as a reminder to our TAC members and our guests. So the TAC session is it's a virtual forum where we come together as TAC members to generate recommendations and provide feedback to OHA on ways that the Oregon's NEMT system is currently working or not working, and looking at ways to make those improve on the things that are working. And improve on the things that aren't working too, of course. In order to do that, the content is really guided by the TAC members. And so, we try to be flexible as we're doing the planning and sort of what comes next and what the topics look like, and how we dive into those topics. In order to do that and have the most productive conversations, TAC members need to be open and honest and humble. Definitely have an opportunity to learn and grow by really recognizing and embracing all of the different viewpoints that you all live every day and that you bring to these conversations. So tons of expertise out there amongst the TAC members that we've seen over and over really sort of lead to some great conversations and some great recommendations for improvement. It's really important. Our best sort of conversations and recommendations are going to come from that active participation during these meetings, between our sessions, and that's the best way that we have through this format to really contribute to and improve NEMT services. A few logistics when using our Microsoft Teams. For our TAC members, if whenever possible, you're able to keep your webcam on, that's helpful to have sort of that eye-to-eye conversation. When you're not speaking, though, if you mute your microphone, that'll avoid sort of crosstalk and make it so that everyone can hear the folks that are speaking. If you use the raise hand function, we have quite a number of people in our room. It's not always easy to see everyone. So if you use the raise hand function, if you want to share information or ask a question verbally, you can also add information and questions to the chat. If you're having technical issues, shoot a message over to Bambi. She helps coordinate these and make sure that we run as smoothly as possible. And just remember to participate and collaborate and engage with our guests. So members of the public are always welcome, but we do ask that you leave your cameras off and mute your microphones for the duration of the season. So that for this of the session, excuse me, so that TAC members are able to be able to have those open conversations. We have a web page where all of the information, including recordings and transcripts and sort of action items and all of those things, slides, etc., get posted to the web page. Usually within a week or so, give or take, of the TAC meetings. So all of the previous TAC meeting materials are out there now, and the materials for this TAC meeting should be there within a week or so after this meeting. All right. So I think we're ready to roll. We're going to start with NEMT call center conversation, and we're gonna first hear from Rachel with OHA, and they're going to talk about the requirements and reporting that OHA expects of call centers. So this is kind of the floor or the standards that OHA has set to make sure that call centers are sort of operating at a functional level that is they're hopefully realizing the outcomes that were put together as part of the program. Um, and just what that reporting looks like, sort of the oversight and monitoring from an OHA perspective of those call centers, and in many cases the CCOs who have responsibility to provide oversight of the call centers that they contract with. So we'll first hear from Rachel. Next, we'll move over to an operations conversation from Gunnar Brinkman at Comtrans and works with the Right to Care program as an operations manager. And can talk to us about sort of what it's like, sort of, a day in the life, if you will, probably more than that, but really looking at managing and monitoring a call center, how they identify and the work they do to work on quality improvement, et cetera. And then after the sort of orientation and kind of two looks at the call center pieces, then we'll really want to hear from TAC members to talk about sort of what your own experiences are like, what's working, what's not, and what you think might work to help improve those call center experiences, in particular for members, but just all of the operational pieces that you all interface with. So with that, if there aren't any questions or additional information that we need to talk about, I'm going to go ahead and turn it over to Rachel. And Rachel, if you want to take us away, that would be fantastic.
Sounds great. Thanks, David. Hi, all. My name is Rachel Manley. I go by they, them for my pronouns, and I am the NEMT operations and policy analyst lead for both the first service brokerages and CCO brokerages. So, as we were talking a little bit earlier, I have a little bit of a background in NEMT in many different levels, but I am just about to have my second month with OHA. So I have also invited my counterparts here, Michelle, who's also within my Department of Transportation, and then Andrea, who's part of our quality assurance department as well, to help speak to and kind of fill in any gaps that I might need assistance for while discussing these things. So the first thing I wanted to share with everybody was we do have reporting templates that we are requesting of brokerages to be presenting us with data and reports about, how driver provided rides are going, how reimbursements going, and of course call centers. So there's been many different iterations of this template. A few even in the most recent months. I think we finally got to a really good space for next quarter. So I wanted to share with you kind of the blank template of what that looks like. I didn't want to share, of course, any specific brokerage information. It really wouldn't be appropriate to be kind of sharing that information in this setting, but mixed with the folks. So with that, we have a pretty small amount of metrics at this point for call centers that we are reviewing and providing oversight for. Can I enlarge this a little bit? It's still too small for folks. Let me know, please. So what we do is, again, these are done quarterly. And so what we want to know for each quarter is what is the average speed of answer or wait time to receive that live voice from, it's very long, when I'll expand a little bit, to receive that live response. So that's from the moment the person calls into the call center to when they actually speak to a person through the phone tree. So again, the brokerages will provide each month and then the total for the quarter. And this is provided in hour, minute, and second increments. The average handle time, so how long did each conversation take per month, and again, total for the quarter. And then the abandonment rate, so calls that were not answered within any time period. Some of them hung up, or maybe we just felt they're on wait, on hold for too long to actually receive somebody, whatever the reason may be, that's what we consider to be abandoned calls. So those again are identified in percentages. So I will probably lean a little bit on Michelle and or Andrew to talk a little bit about what the qualifiers for the metrics that we do capture, kind of gives us an idea of what's ideal and what could be improved upon, because that is the space I'm still learning a little bit about too. So Michelle or Andrew wants to tackle that portion.
Yeah, sure. I'm happy to jump in and see what Andrea would like to add to that as well. Good afternoon, everyone. Michelle Mavison, as Rachel said, I work closely with them within transportation programs. I have been involved in the NEMT space, but I'm turning my attention these days over to ground emergency and air ambulance and other areas, but we're still on that same team under Nathan Roberts at OHA, and so excited and grateful to have Rachel on board now and with that prior experience with NEMT. But yeah, as far as the requirements that we have going through reporting, and this is stemming from CCO contract requirements for the answer rate and the amount of the percentage of abandoned calls. So we look at that as something that we can evaluate when we receive these quarterly reports. And like Rachel was saying, they just wrapped up reviews for Q4 2024. And so there's always that lag in which quarter we're reviewing. And so when we look back at whatever the figures are, whatever the data is in the report, we do see if they're qualifying. So for example, abandoned calls per the contract is no more than 5%. If we see that above 5%, then we call that out within the review. And it is technically out of compliance with what's in contract, but we're not sticking any penalty to that. We're really trying to have a very collaborative nature with the CCOs and through the reporting that they receive from the call centers up through the CCO is really just to see where they're at and how that's trending from quarter to quarter as well. So if it stays above 5% and what they might be doing to learn about, what they're doing to mitigate when it's out of the compliance. So there is that compliance aspect to it, but there's nothing punitive about it. We're really just trying to better understand and work with them to see how we can get that percentage down if it's above 5%, for example, for abandoned calls. And to see how that's trending over time, we're also working on putting together metrics so we can have a baseline of understanding with that. So it is coming out of contract requirements, but it's a really collaborative approach that we're taking with the CCOs that report that quarterly information. So I don't know, Andrea, if there's something you'd like to add about that.
Yeah. I think the only thing that I would add is that, Rachel had mentioned earlier that there are multiple versions of this template reporting currently because we did some back-to-back changes. And I just wanted to call out that in the Q2 2025 version, we did make updates to the language in the call center info tab because those expectations are coming out of contract, but we discovered that the framing of that information was not really clear in the template. So instead of average speed of answer, we're clarifying that we actually want to know the answer rate because the contract requires that calls are answered by a live voice within 45 seconds. So we're updating that so it more accurately reflects that requirement. And then also updating it to include the requirement around understanding the average hold time. So there are some tweaks to get it more in line with the contract.
I meant to unmute and stop sharing for a split second. So what I'm showing on my screen here Oh, go ahead, Michelle.
Oh, sorry. And I was just going to add for further updates that we would want to make potentially like through TAC recommendation or any which way, those do need to be communicated and posted to the CCOs 90 days in advance of the change. And so there'd be a process of engagement with interested folks before any change is made. There would be an internal review with OHA leadership, all leading up to a 90-day period, which those changes would need to be posted and communicated out before any changes can be made further.
And I will get to Henry's in just a second. I just want to express that page that I'm showing here is all of our templates within OHA that have been processed and adjusted throughout the years. It's a huge list, to say the least, but this is accessible for all. So if you're ever interested in learning more or curious, you can always jump in here if you're again, interested in those things. So just wanted to share that there is that information. The other thing I wanted to share really quickly was not only is the templates there, we also have instructions for our brokerages. And this breaks down what's expected as well as definitions of what we're asking for to be captured in those reports. And those get updated as well at the same time, usually, as the new forms templates are being created. So I'm going to put the link in the chat if there's any questions or interest in looking at the other templates that OHA has. But with that, I will take a seat and go to George to see the numbers first.
George, did you have a question or a comment?
Yes, I do. Now, going back to what you were saying, as far as on the white backspace that had those things that you were showing on your presentation. Have you ever thought about, because there are like 15, 16 CCOs, I was wondering, would you guys hesitate and maybe with this month-to-year thing, and then the total for the quarter, make it to where you could make it into a bar system as to when the answers come out on those questions that you're asking, like the abandonment of the rate percent of calls. I would think that if you make the bars, you could show the difference through those many CCOs of who's actually doing the work.
Oh, you mean like creating a bar graph?
Correct.
Yeah, so we definitely can do that internally. We can create a fair amount of different tables and such to identify, what the trends are. And that's actually kind of what Michelle was talking to as well, is that we're working with our analytics folks to really determine what those metrics look like in other spaces beyond the call center. That way we can continue to support the CCOs and brokerages to say, this is what we have in contract for you. This is the expectation of what we would see being provided for this certain deliverable. And this is how you're performing. If that's, you're meeting those expectations, fantastic. If you're not, how can we collaborate with you to help improve that?
Now,
so this is this data that's coming back from the brokerages for us to review.
Okay, so is this the telephone number that consumers are calling into the brokerages, or is
Correct.
this telephone? Okay. Okay. Thanks for making that clear.
Absolutely.
Okay.
And maybe just sort of, I think maybe the part of the sort of bigger question that George was asking was in terms of sort of visibility, by the public and by CCOs themselves, sort of, are they able to see sort of how they're performing in comparison to other CCOs, and is the public able to see that, what these reports look like sort of over time, displayed in, ways that would be sort of quickly digestible, like a bar graph, like George is suggesting.
Yeah, that's a great elaboration, David, to bring to that question. Currently, we do not have any public facing information in regards to what's been reported to us thus far. I think a lot of that again has to do with the changes and iterations of information that we've asked for over the last few years. But again, we're working now with myself and such, and the team is working with Andrea and other folks from quality assurance to develop those metrics. And I think, once we have those in a good space, and something that's going to be easily digestible, we can definitely talk about the opportunity to be transparent in those spaces.
Okay. All right, great. Thank you. So it looks like Tim's up next, I think.
Yes. A question about the abandon rate. What is considered an abandoned call? Is it a call that is hung up before the 45 seconds? So anything within that 45 seconds is considered abandoned as far as the reporting. So if they call and hang up in a second, that's an abandoned call.
I'm going to go to our definitions.
It's on 7, page 7.
Of course, Tim. Thank you. So, total number of calls abandoned prior to a live response, reported as a percentage of all inbound member or representative scheduling calls that were abandoned prior to a live response. Kind of circular in the response, I will say that. But that is, any phone call that was picked up, phone number dials in, phone tree picks up, they hang up, that's an abandoned call.
Okay. It's always been confusing for me because it's not really an opportunity for the call center to take that call. We have people that maybe call in and they may hang up within 5 seconds or so.
Might be a pocket dial or something like that.
Yeah, and so those get reported as abandons. And so, yeah, I just wanted to clarify. Thank you.
Yeah, no, I appreciate that. And I think that's a good thing to mention as well for something that we can continue with these like updates and iterations to maybe pull apart a little bit more to be specific to, if somebody has been on the phone for more than 45 seconds and hangs up.
Yeah, I think I like that idea, and maybe we can come back around to that when we have our discussion here in just a little bit about sort of recommendations or clarifications. And so, Tim, if you can plan to bring that up again, that would be great. And then we can talk about sort of what if there's an amount of time that you all think would make good sense. So, John.
Yeah, so I appreciate your desire to address whatever your metrics are by way of efficiency and time. I am concerned that you not lose sight of effectiveness of the call for the consumer. It could easily be sacrificed if there is an overemphasis to get through calls, that you might sacrifice the ability of the consumer to better understand. I see you nodding your head. You probably recognize the issue. I think one is far more important, that being that the consumer understand is far more important than racing through the call. And it's only recently improved. I must say my experiences have improved, that the quality of my conversations with the person at the other end of the line has gotten much better than what it had been, and I would not like to see it regress.
Thank you, John, for those comments. And I agree with you wholeheartedly. It's always a very delicate balancing act of, being able to be efficient with the call taking to gather the details needed while also providing excellent customer service and patience, because we know all folks have different learning styles and, auditory processing and things like that. I'm thinking of myself in general. I do have sometimes an auditory processing disconnect. So I agree with you. And I myself actually have formerly been a call taker for NEMT. That's actually how I started in this benefit. And so it was always really important to me to provide excellent customer service and patience and support for the members calling in, while also, establishing all the details needed to complete that trip appropriately. So that is something we definitely consider when looking and creating these metrics for call times, on how long folks are on the call with somebody, and also allowing for, additional supports for folks that need to be on call longer for whatever reason it might be. So, were you doing a thumbs down, Tim? Is that what I just saw the?
No, sorry. I had somebody at my door and she said, "Is it good to come in or not?" And I'm like, "No, don't come in."
I was like,
sorry. I said
Tim,
I did
stop
this. I
being
thought it
rude to
was going to be
Rachel.
sufficient.
Stop being rude to Rachel.
I missed the phone call part. I just saw it look through my eye. I just left.
I tried the phone thing and it didn't click, so I apologize.
This is John again. I'm wondering if there's value in marrying the two, that being the statistics that you're trying to gather here, and at the same time reflect the quality of the phone calls as you measure them.
Yeah, I think it's a really good point, John. And I think this is another area that if we have some time, we should talk about it. So, as you mentioned, sort of all of these that are being tracked right now are sort of are quantitative numbers. Important, obviously, for somebody to be able to get through to the call center in a reasonable amount of time and get to a live person that can help them. But doesn't tell that full story, certainly, about the qualitative part. And so if there are ways to sort of assess that, that would be great. And maybe we can do a little bit of brainstorming on what that might be. All right. John, your hand is still up. I just want to make sure that you haven't put it down yet, or if you had something else you wanted to say. There you go. All right, cool. Rachel, is there anything else that you wanted to go over before we move on to the next topic?
I think that gets us to the nitty-gritty of what metrics we're working on right now with the call centers, and then as we're considering to improve other aspects of reporting too. All of this input and feedback is excellent and helps us really be able to address those issues or concerns head on, and again, making it a really good experience for our members, because that is the reason we are all here.
Yeah, great. Well, thank you. And just to make sure, were there any additional questions for Rachel or the team at OHA on this topic? All right, great. Thank you, Rachel. And thanks everyone. So next we're going to move over to a presentation from Gunnar. Gunnar, if you want to introduce yourself, and then you can roll into your presentation.
Yeah, of course. Good afternoon, everyone. My name is Gunnar Brinkman. I'm the operations manager here at Comtrains. We serve the Right to Care program as the same day, after hours call center and dispatch center. And Right to Care covers, for those who might not know, we cover Multnomah County, Washington County, and Clackamas County. And I'm going to share the screen here. Is everyone able to see the PowerPoint?
Yeah, we've got it.
Awesome. So I'm going to be covering some of the points that Rachel brought up previously around what our current metrics look like, our service level agreement, where we're at for the March and April of 2025, and then go into some quality control we do here internally and some other information of what services we offer to our members. So some of those additional services that we do that maybe other brokers may not do is we have a specialized dialysis line that has a dialysis coordinator who works directly with members and social workers to pre-schedule vehicle provided rides, as well as handle their mileage reimbursement option and bus pass option for our members. We set those up with our members a year at a time, because dialysis is very important that those types of trips are not interrupted. So we found it necessary to make sure that we have a focused team that handles all of those types of trips. We've done the same thing with our facility line, and that's working with the SUD clinics, mental health, and adult day centers that have continual ongoing rides, and we want to make sure that those are not interrupted. And then we also have a specific line for hospitals to reach us. That line in particular is not represented in our service level agreement because it is not a member-facing queue. That is a queue that works directly with facilities and hospitals, and that's where they schedule discharges and or appointments after a discharge for members. Maybe they're in the social worker's hands, and we speak with them and set that all up. And then we've also developed a discharge portal that is for hospitals to use that online, and it feeds them real-time trip information, etc. Looks like I have a hand raise. Go ahead, George.
Yeah, when you're in the process of having that set up, how do you know that the hospitals may be lying, that they really need to have people discharged or not be discharged?
So if the hospitals are requesting a discharge, we have to go based off of the medical professional that they're cleared and ready to be discharged. The only time that we come across maybe issues with the discharge process is if we find out the drop-off location might not be prepared to receive a member, and then safety concerns are brought up, and then we interact with the hospitals at that level to really get down and make sure that everyone is aware and can receive the member in a safe way and manner.
Okay, the reason why I'm asking is because Medicare is now requiring that if someone's in trouble, that they need to be in the hospital when they're being treated one time, they got to be in there in a certain amount of period of time, and not always coming back all the time because of fines being imposed in the hospital. That's why I was asking.
I will say we do monitor it. If you're speaking on continual return trips to hospitals and then continual discharges, that is something that we do monitor on the dispatch side of things to make sure that we get those in the hands of our transportation social worker that I'm going to speak about in a moment, and identifying maybe giving them a higher level of care through Care Oregon's care coordination plan to make sure that they are getting the help they need and not continually having to go back to the hospital.
Okay.
And then a little continued information around dialysis and facilities. We, again, work directly with our NEMT provider network and to schedule these vehicle-provided rides with them to make sure that there's no interruptions. It brings up the member interaction with the providers because they know who they're getting, and they're hopefully going to always be timely. And if there's any issues, instead of having to call us, we can interact with that provider, and we can do that in between and make sure that information is getting to where it needs to be to reduce no-shows, etc. And we do that, again, with the SUD clinics as well as the mental health and adult day centers. And then speaking on the transportation social worker that we've hired over the past almost 2 years now. Almost three. So we found a need because we are the same day after hours, and there's a lot of times where members call in and they are in need, and we're a call center that books trips. But people do call us as we might be the only number they have, and they need additional support. And through the care coordination system that Care Oregon offers, we've been able to hire that social worker, engage with these members outside of maybe the crisis moment, as well as through the dispatch side of things, identify members that might be in not great living conditions due to them maybe not being ambulatory anymore, but they have stairs. And so that puts a strain on the NEMT provider network on being able to transport them to their appointments. And so we work on getting them new housing and or getting ramps installed at their property or additional tools for them. And we've been successful over the past 3 years in actually getting that done, which is great for all involved. As well as identify possible no-shows due to incorrect vehicle types or notes, where we have a tracking mechanism in a tool we have called CloudTrans that we use. That's where the discharge portal is, and other tools that we've developed to make sure that we're tracking that and then following up with our screeners and transportation social worker, making sure those notes are up to date and correct, and finding correct providers and making sure everything is going to go smooth for their future transports. Go ahead, John.
Is this counselor licensed? Are they LCSW? Are they an MFT? Or are they under some licensure? Are they professional counselor? I guess what I'm asking.
So yeah, so he is not credentialed. He does have a social work degree, but he connects them with the care coordination program that then will get members to credentialed individuals for additional support.
Thank you.
Yep. And then going to what Rachel spoke about previously about service level agreements. This is a 2-month look back, so March and April of 2025. So there's some charts over there to the right. I know they're a little hard to see, so I kind of put the information to the left-hand side. So total calls we received for the last 2 months was 57,276 calls, which is a lot of phone calls for not the main call center, because Right to Care actually has 2 call centers. We have Future Trips, which is operated Monday through Friday, normal business hours. And then we have us, which is the same day call center for urgent same day trips, and the after hours call center. Our SLA agreement, as Rachel was saying, service level agreement, is answer calls within 45 seconds, which we were able to do that for about almost 35,000 of those calls for that 2-month period. So in March, we answered 80% of calls within 75 seconds. So we're about 30 seconds off of that service level agreement in March. And then unfortunately, April was not better. And we answered 80% of our agreed calls within 120 seconds. I will say, going to what was spoke about earlier about making sure that it's not lost, that those calls are, we're not rushing through the calls. So we really do focus here on single call resolution to make sure we're supporting those members and getting everything taken care of during those calls. And so that's where we can see our call times going a little longer. And I have data coming up that our call times have increased from our initial want of 3 minutes and 30 seconds. We're honestly teetering right now at 4 minutes 45 to 5 minutes a call on average. And then the overall average for March was 56 seconds. If we combined all the calls, it would be 56 seconds. And then average time to answer for April was 1 minute and 13 seconds. And then we continue to try and find solutions to the call volume, see if there's anything we can do automation-wise, or give members access to additional tools to be able to see this information without having to call in and wait on hold for extended times, etc. And then going to our abandon rate, we're able to meet our abandon rate, which is great. People aren't hanging up. They're sitting through the maybe longer hold times than usual. March was 4% and April was 5%. And then this is some more data here. As you can see, this is call volume per day of the week. It changes, which is a staffing problem for us to make sure we can meet everyone's needs. If it was the same every month, we would be able to staff better. But since it changes every month, it is hard to be able to adjust schedules in that way. And this is April's data over here. And then this kind of breaks it down. Most of the individuals calling into our center are members directly at 66%. The rest of those calls are either care coordinators, social workers, caregivers, hospitals, representatives of the members. And then for our call center, the highest percentage of calls at 42% on average is ETA or trip check, which is a member calling in, hey, where's my ride? And or who's my provider for the day? Those type of things. And currently with that information we review monthly, we try to find those highest volume of calls and then do an internal look with our QA team as well as our leadership team to identify how we can do those calls better to reduce the length of those calls and then be able to answer more calls or give those tools to agents that might have longer calls than we would like and work with them one-to-one and make sure that they're being able to give the best customer service we possibly can to our members. And then from review, for a scheduling side of things, to make sure we can meet our service level agreements, this is kind of a spreadsheet that we utilize. As you can see, this was for April. These numbers up here quickly, this shows 3 is the amount of people we want. So that means we have 3 over our initial need because we have call outs, people are sick, people don't show up. And so that's where we always try to get 3. But as you can see, as it goes on, we get minus here. And that's where we have those tough call times. And to be able to manage that, we have our auxiliary team, myself included. I answer the phone calls during these times that we need extra bodies on the phones to try and make sure we're meeting everyone's needs as possible. And we also developed a cancellation line. And so this has helped members not have to speak with someone, call directly into us. They leave a voicemail, it'll be canceled. And this just shows from 2024 when we introduced it. I will say usage has gone down over time, but it still is a better tool to have members be able to cancel trips without having to wait. Because especially if it's an urgent cancel, we don't want to have our inability to answer the phone in a quick fashion to stop them from being able to save a no-show, right? To make sure that providers aren't showing up for members when they canceled the trip. And not only do we look at call types, we also look at what we call coaching incidents. So maybe errors on trips or errors when speaking or errors we find through reviewing providers when they're picking members up, things of that nature. And so we review all those, we put them into our CloudTrend system, and then we review them with our team to make sure hopefully that issue doesn't occur again to provide the best member interaction possible. And we also don't only do it for our internal use, but we also do it for our provider network and our other call center and make sure that those coaching incidents go out to the parties that need them to meet with their agents or NEMT providers to then hopefully correct the issue so members don't experience that issue again. This is more of a level of not a feedback or a grievance, but more so, hey, my driver was a little late. And then we go, okay, we'll go ahead. Do you want to file feedback? No? Okay, well, we'll do a coaching, we'll follow up. And this is another way to follow up in those instances that might not reach that grievance feedback level. And then we also do an internal call review. It's a requirement, and we make sure that we are giving the best customer service again, hold times, making sure we're introducing ourselves, providing professionalism, and we meet with my supervisors meet with their agents every 2 weeks and or continued further, which is shown here. And then with additional any updates that OHA might send out, Care Organ might send out, or we make the decision internally to make any adjustments to our processes or new processes, we have a reminder system that goes out to our teams in their individual teams chat. So like a Teams call like this, we have individual teams with groups. All of that information gets put there, then brought up in their one-to-one meetings, as well as emails and documentation goes out to our team. And then we review that new process to make sure we're doing it properly and we focus on it in those next couple of weeks when we're doing coachings and review with our agents. And then closing up for our future development work that we're trying to do here is we have a TNC pilot review and consideration for implementation. I believe it's been discussed in this meeting previously. We are trying to spearhead that to, again, support the members in the best way we can. And then increased collaboration with medical facilities and hospital groups. I meet monthly with Providence now, Legacy, Kaiser not as much, and OHSU, which is new this year, to make sure that we are being able to provide their staff that they're trying, so there's no interruption to their ability to help members of our community that might be coming into their ERs or hospitals. And then we are working on another online portal similar to what we have built for the hospitals, but for facilities. So medical facilities, skilled nursing facilities, things of that nature. And then more automated trip check where you might be able to call into a call center, click an option, enter in identifying information, and it will automated message will give you that information. So again, you don't have to speak with someone and you'll get the information at your fingertips. Does anyone have any questions? Hopefully I made it on time.
Yeah, did great, Gunnar. Thank you. Tim.
Gunnar, do you guys use an app for your NEMT side for members to schedule rides?
We do not. So I will say we have worked. So we use EcoLane as our scheduling software. And we have worked. I spent, I think, almost a year in a work group. And we did a lot of work on that. And we could not. So our scheduling software does have limitations, and they could not get it to the level that we needed to make sure that the members understood how to use it, as well as our staff, right? So we are currently trying to develop something similar to that outside of that platform due to the barrier to entry that we found.
Sure. I don't think it's unusual. I think most agencies struggle with an app that's simple and easy to use for members because there's so much complexity and detail that needs to be, provided that it's hard to capture all of that without confusing people. So thank you.
Yeah, 100%. That is exactly what we found is inability to have us get the information we need to make sure that that trip goes without, happens without any issues. Now with, we are looking at other easier ways to do it. Like if someone uses mileage reimbursement or bus pass, we don't need all that information, right? And so we could maybe utilize it for that subgroup of members that utilizes those other modes of transportation.
Sure. And does EcoLane have a AI chat option, or are they developing something like that? It seems to be very prevalent with in software now, and it's very impressive. But I wonder if they have something that you've seen.
Not that I have seen, no.
Okay, thank you.
Thanks.
Any other questions from the group?
Great presentation. Thank you so much.
Yeah. Well, folks are thinking about that. I wanted to check in with you, Charles, to see if you had anything else that you wanted to share or go over. It was a pretty comprehensive presentation, so you might not, and that's cool.
Yeah, I mean, Tim, to answer your question more directly, EcoLane just has a number of severe limitations, and that unfortunately, many of them relate directly to the booking and routing side, and so the ability to focus on any sort of development around apps or anything else like that would be really good. Now, we have our own internal software product that we currently do our discharge portals with. We manage a bunch of trips. We do our coaching modules there. we are working on doing texting out and other options for weather issues and things like that. So frankly, a lot of the development probably is more likely to happen within our own internal software package than it is probably with Ecolane would be my guess. We recently met with Uber Medical, and our platform actually has an API directly to their platform. And so, for example, if Care Oregon decides to move forward with the TNC pilot, actually with Ride to Care, that process will likely be managed through our system directly to Ecolane. But that was actually built because our company worked with them down in actually Arizona. And so that kind of came with the platform, which is kind of good. So it makes the entry point easier. But yeah, our internal developer is a lot more nimble, and we have a lot more control over that. And so that's probably more likely the future of the member facing or facility facing side is going to be with us instead of actually with the booking and routing software that we use, just because of the type and nature of, and actually frankly Ecolane is not really meant to do the work we do with it. We've done a lot of workarounds and kind of wrung every bit of piece out of it that we possibly can. But trying to find a package, a readily packaged deal with a bow that we can buy off the shelf for the work that we do, frankly, doesn't really exist. So we
And
kind
I
of have
think
to
it's
make
actually
it
harder in Oregon because Oregon is a very different animal than back east. And so
correct.
a lot of the
Yep.
times when you look at any MT software, it's kind of built for back east. You get
Yep.
into Oregon and you're like, what? You don't do this? What? You don't do that? What? You don't do that? It's very different. And so you almost end up having to negotiate software development on top of the platform. So
Which is very expensive.
Yeah.
yes.
And slow. And the issue is these are national companies. And frankly, while Oregon is pretty innovative, and yes, we do some things that are our own special Oregon way, we're still a small customer. So to get the customization and unique development that works with the way that we interact with Medicaid, that we interact with the transportation system, that we want to interact with our members, frankly, is pretty time consuming and resource prohibitive. Which is kind of why we develop our own in-house product, because that works better, because again, we control it. We can kind of set the pace, the cadence, the time, such. Yeah. George, yes, sir.
If the CMS from Washington, D.C. was to hold another session for all states to come together and talk about the EMT, would you be willing to share with the CMS in D.C. about your findings and what you found with your program?
Sure.
Okay. Because they may be interested in DC.
Yeah, so I actually worked for the previous broker. So over the last 8 to 10 years, it became very obvious that there were certain key things that were really important for us to handle and manage appropriately. Things like alcohol and drug treatment, dialysis treatment, hospital discharges, stretcher trips, ambulance. Those are all key components. And so over the course of most of the last decade, and also with the support of HealthShare Oregon and Care Oregon, we've really spent a lot of time and energy and effort trying to hone those pieces in, so that when we manage those, the rest of the program is much easier to manage. Yeah, I mean, not only is Oregon a unique place, but it's great that the CCOs are willing to, put the time and energy and effort into trying to make the overall experience better. So,
Because California and New York may take you up on it.
Right on.
Yeah,
Thank you, George.
To Tim's point, it seems like for whatever reason, a lot of the software gets developed in Michigan and Minnesota, and Massachusetts. I'm not sure what it is with the M states, but that's where a lot of the things come from. And we're just a little bit different here on the left coast. So.
I noticed some come from, there are a few in Canada too, so.
Oh, yes. So to keep with the M thing, we'll go with Manitoba.
Or Montreal.
Montreal, yeah.
There you go. Well, great. Thank you so much. I think that Charles and Gunnar, really great information. It's really interesting, I think, to be able to see like all of the different things that you're able to track, and the things that you're paying attention to, and the strategies that you're putting in place to address where you start to see bottlenecks or problems with those figures, with the metrics that you're looking at. And I especially appreciate the different workflows, the shorter workflows that you're able to put like sort of specialized people into, so that they're not sort of jamming up the other folks. I did have what I hope is a fairly short question, but if I understood right, it sounded like your call volume was up maybe substantially from what it has been in the past. And I just wonder, if I understood that correctly, if I heard that right. And if so, if you have some ideas or knowledge about sort of what's driving that increased volume.
So for this calendar year, the call volume overall is pretty flat. We're up about 20% year over year. So last spring versus this spring. And the other piece is while we don't focus on call handle times, because our goal is it's always better to get everything solved on one call, even if it takes 7 or 10 or 12 minutes versus, saying, whoops, I'm sorry, we're approaching 4.5 minutes, call us back. But as call times go longer, that means we need more bodies to answer the phones in 45 seconds. So to be completely transparent, the data shows that while we met metrics for most of 2024, we aren't currently for 2025. So there's a couple of things for that. Is that our call times are going longer, which means, again, and it's while you can handle that by hiring 15 more people, that might not be the most cost-effective way. So what we're continually looking at is, and in fact, we've over the last 90 days, what are our calls, what are the people calling in for? How can we address that differently? And actually that's where the cancellation line came from. People didn't want to be on hold for 1 or 2 minutes and then punch a bunch of buttons to cancel a trip. And so trips weren't being canceled, which means our no-show rate went up. So we tried to make that easier. We're now looking at, since the biggest part of our calls are, where is my ride? Where is my driver? What time should I be picked up? Even though we already give folks that information, they get nervous, and whether that's historical or real. So we are looking at, rather than just putting more bodies in the seats, is maybe we can develop a texting app where you put in your PIN and your trip number, and it will automatically spit back out. Your pickup time is 9:45 and your provider is blank. So rather than making people call and wait on hold and ask the questions, what we're trying to do is find ways to funnel people off of the phone into ways where they can get the information without them having to wait, and without bottlenecking the rest of the phone system for other folks. But that's also why we've created the hospital discharge line. We've created a specialty team that do high needs members, wheelchair, specialty, stretcher, and hospital discharges, because those calls are longer. And so we train a smaller number of folks to handle those longer calls and peel them off of the main queues. So the more that we can specialize and use other tools, that works better for everybody. We create specialized teams that meet individuals' needs better. And for general calls, there's fewer folks there to actually bottle up the main system.
Great. Thank you. That's very helpful information, and great to hear like I said, the alternative strategies that you're looking at to try to address the issue. So, super interesting information. Really appreciate it, and appreciate the work that you do. So now we're going to sort of shift gears a little bit, move from sort of presentations to talking about with TAC members, sort of what ideas do you have for improvement? Part of that might be talking about sort of the issues or areas that you have frustration, and then maybe we can do some brainstorming around that in terms of what might make that better. So I'm just going to open up the floor to TAC members and see what you got. Anyone want to kick us off?
I guess I can start.
Okay, thank you, Tim.
I think for us, there, like for instance, the abandon rate. Typically when somebody comes into the queue, you're getting some information, you're trying to direct their call to a certain queue, and then you're giving them, hold time and their place in queue. And so I think what happens is sometimes if we're reporting like the abandon rates before they're able to get the information to where they need to actually go, it can make it look like we're not really doing, or we're not handling these calls, when we're actually just trying to move them through the IVR system so that they can get to the correct department. Like, you need to be able to be transferred over to QA or scheduling, or if you are, canceling a ride. All of those are questions that get answered and options that can be selected. But if they are hanging up before that process is complete, it counts as an abandon, which really I don't think is fair to the brokerage, because they really are still just trying to provide information through the phone system to get them to the right department. So for me, abandon rate's always been kind of, there's a long and a short abandon. A long abandon may be, a minute or so, where a short abandon may be less than 30 seconds or something. Those realistic timeframes where realistically the brokerage would have the opportunity to handle a call timely. So that's just one of the pain points for us. That's always just been kind of confusing.
Okay. And Tim, with that, sort of thinking about this in terms of long abandonment rate and short or quick abandonment rate, are you thinking that it might make sense to report those separately? Yeah. Okay.
Yeah, because they are different, and they do show, they kind of tell a better story of really how the calls are flowing. Like if somebody within 30 seconds is like, oh, I don't need this call, or my rights or whatever, that's a short abandon, and it can mean something different than somebody who might be in the queue longer and hangs up. That to me would be something that we would really need to address. The short abandons are just ones that we just haven't had the opportunity to handle.
Yeah.
Timely.
Okay. All right. So it looks like we've got a couple of members, TAC members in queue here. Charles, do you have some additional thoughts or questions?
Yeah, Tim, you're spot on. So the point of measuring abandon rate is not serving members. So folks that call, hey, where is my ride? Wait a minute, they're here. They're on the phone for 7 seconds. They pocket dial, they get into the queue, find out I hit the wrong button, hang up. So there should be I think we all understand internally that there's a number, that anything that drops off before that isn't real, and that's not really what OHA wants to measure. So I think we can collaborate and come up with a a better metric to address what they're trying to measure, that measures and actually captures what's really going on and is not just a number because we report it. So, and frankly, with Michelle and Rachel, I have every reason to believe that they're willing to play ball, because at the end of the day, it's about reality and not just reporting numbers. And I think everybody gets that. So thank you all.
Okay, Charles, that makes sense. John, you have some thoughts on this issue? John, I don't know if you're on mute, but if you're talking, we can't hear you. All right, John, we seem to be having some technical difficulties, so I'm going to skip over to George, and then I'll come back to you, John. Go ahead, George.
Yeah, the frustration well, I'll just speak for myself. The times as a consumer, and I've heard it from many consumers, they would like to get home and not have to wait for so long after their doctor's appointment. And they want to be able to talk to somebody. What I'd like to suggest to Tim is maybe another phone number outside of the TransLink phone number, if he's able to do it, for consumers to call in that really want to talk to somebody, to maybe speed up a process of a provider not doing their job, picking them up on time.
So in our queue, we actually do have an option for them to go to the quality assurance. If we have another number, that call would just come back into the same queue that we have with the other phone number. But we do try to capture or offer the most requested departments, and so that they can, if they need to speak to QA and make a complaint, they can go directly to that department without having to sit in a queue. Same with cancellations, or if a driver needs to add like a pharmacy stop, they don't have to sit in queue. And that we've learned the hard way over the years, of people sitting in the queue waiting to go, I need to cancel my ride. Doesn't make any sense. So we give them the opportunity to cancel their ride through like a voicemail. And that works for us, and it allows them to cancel their ride without any penalty or without any issue.
And George, just to, I want to make sure that I understand sort of your question. Are you talking specifically like an expedited line for those like return trip home, or just in general?
Well, now I'm learning from other consumers. They are wanting or hoping that there could be an provider that could expand their fleet to maybe overcome this problem. And they don't know who to talk to. And I sort of agree with them. If a provider could expand their fleet with maybe 22 cars or vans in their fleet to maybe help with the congestion. Maybe I might be wrong, but.
So I think, George, maybe what we do is certainly an important issue, and maybe what we do with this is like we put this in our parking lot for today because it sounds like it's really bigger than sort of call center, right? I mean, the call center is scheduling the rides that they have available, and so we look at learning more about sort of what is that expectation from like OHA and the CCO perspective in terms of getting those rides scheduled, what's the wait time, max, et cetera. Especially for those return trips where the person's, they're not sitting at home waiting, they're sitting at a doctor's office, and sometimes those are closing, et cetera. So it's certainly an important issue, and I think it's one that we should dedicate a little more time to than we have today, if that's okay.
Yeah, yeah.
All right. Oh yeah, go ahead.
One more thing. The one thing I heard from CMS, one of the biggest problems I've heard from CMS in DC is not getting the NEMTs across all the states information fast enough between brokerages and providers, where there seems to be a jam up. And this is coming from the CMS in DC, trying to understand this.
So the information that you're talking about from the brokerage to the driver is the like arranging a trip, or what's the information?
Yes.
Okay.
From my perspective, in my first meeting where we all had this in all the states, which I don't know whether I had mentioned to Tim or not, there is this blockage that all the, that there's CMS was trying to figure out a way how to get information faster between brokerages and providers. So if there was a consumer that really needed to be picked up, that another provider wasn't picking them up, how could the consumer be picked up?
Okay.
And that's
okay.
This is a CMS's deal. And
okay. So I think, George, I think that seems really closely related to the other piece in terms of sort of addressing that issue and where those barriers might be. So let's focus on those things when we have that conversation. Okay.
Okay.
All right, John. Let's try again. See if we got you now.
Oh, we'll see if you can hold me.
We got you. We can hear you.
The bandwidth thing. So I wanted to echo the concerns that were being made about the spectrum of calls that were being deemed abandoned. I think that there might be also a need for linkage to the quality assessment stuff that's done, because I think you folks were being overly gracious to pocket dialing. I think that more often it's the consumer who is either experiencing some, perhaps recurrent trauma, and they get frustrated and hang up, or you just have folks that are impatient. But it seems to me it would be good. Well, I don't know. I don't know if it's a good thing or a bad thing to know who the impatient ones are. That might work against them. But I would certainly, I've always thought it interesting. But I just want to throw out my remark. I echo your concern.
Great. Thank you, John. And that's super helpful to hear from other members, TAC members, about this particular issue and sort of voice your support or express concerns as we're thinking about making recommendations to OHA about abandon rate and splitting those into two. Elisa?
Yeah, this is really for Charles and Gunnar. I was wondering, how transparent are you with these changes and with like having the specialized groups? Because your presentation was just beautiful, and it really sounds like you're doing a lot of hard work on trying to improve communication. And I'm just wondering, how transparent are you being with the providers, letting them know about these that you're really trying to specialize and get those rides met? Is there something that you're putting out or that you share with them when they enroll an individual that might be on dialysis or might be in a facility?
Um, so excellent question. So we send out any sort of change that affects the transportation providers. Those get notified immediately. We also have quarterly meetings where we meet with those folks face to face as part of the Ride to Care partnership. As far as the specialty programs for the substance abuse disorders and the specialty clinics that we work with, we actually have folks that work directly with them. And so we keep those folks in the loop. We've done a lot of work around trip verification, trip management, those type of things. So we keep in regular contact with them, and as Gunnar indicated, he actually meets with the hospital groups, many of them on a monthly basis. And I, as actually a regional director, I also meet with the hospital groups on a pretty regular basis. And so some of the issues that we're going to be working with this current year is we're going to start working with some of the places where our folks go on a regular basis that can't transfer off stretchers, and so that are creating a bottleneck in some of our stretcher transports and other things like that, where we want to go on site and strategize. And then also we have a new substance abuse disorder clinic or facility that's coming online soon, and we're actually going to go tour there, and so we will be educating them, understand how exactly the program works, who to be in touch with. So yes, communication is incredibly important, and to the greatest extent possible, we want to keep that moving quickly. So.
And then I just had another question, just to or just a thought to reduce anxiety for individuals that are calling, just to check on if their ride's coming or if they're getting picked up. Have the staff taking trauma informed trainings?
Yes,
I really
actually,
okay.
Yeah, we both do trauma-informed care training here, and we instituted, there is so I actually got into transportation after 25 years in social work, and so that's where my heart lives. And so I also brought on a program, and it sounds a little weird. It's called Nonviolent Crisis Intervention. What it really does is it talks about the importance of language and how to interact with folks, how to engage and how to disengage when needed. And so all of our providers that work on our transportation side, on our ambulances, and all the folks that work in our call center go through both of those trainings. So the work that we do is at its core customer service and social work. We do transportation. We're a medical company, but we also we are a customer service company, and we take that very seriously. So yes, that's something that we definitely prioritize here.
Thank you.
Great. Thanks, Elisa, for those questions and comments, and thank you, Charles. Tim?
Yes. So one of the things that we, and I might be kicking myself, and sorry, Gunnar, for bringing this up, but the call center information, like one of the things that's always been kind of frustrating for me is that in this report, we're only reporting half our calls. Only half of the work that we do here is out or inbound calls. There are a significant number of outbound calls, which I think are also valuable to capture. We report those in our monthly reports, but there are times when our inbound calls are as many as our outbound calls. And sometimes our outbound calls are more. I mean, you have to remember that there's the efforts of reaching out to people If you don't connect with them, you have to make several calls, in attempts and then leave a message. And so capturing that work, I think, is valuable in this report to show that not only are we taking a lot of inbound calls, but we're also making a lot of outbound calls with the same call center that we have. And then as far as like, there's some confusion, like for us, we report checks literally based on the reason why we have to cut a check. Typically, it's somebody who is undocumented, and that's how we issue out a check. But everything else that we do is through a debit card, and so that's how we report that. I don't know if that's really what the interest is to collect the physical checks or just the payments for reimbursement.
Okay. All right. Yeah, really good points, and I think some opportunity for us to explore that, especially on the outbound call piece, and getting more information about that. So, John, and then we'll probably wrap this conversation. So you get last word, John.
Oh, thank you. I wanted to say, when it comes to information sharing, I know I've seen a lot of presentations on NEMT in the Community Advisory Council and board levels of the CCO that I belong to. I'm certain that occurs in the sister CCO for my county. But I've not seen, I think perhaps in one time in a senior advisory council, and I'm wondering if it might be fruitful for you to put together among a few couple providers our brokerages like Charles and Tim, a presentation to the Oregon Association of Area Agencies on Aging and Disabilities. I would suggest, if you do so, to have perhaps developed some modeling of the information that you would suggest that brokerages could share with their local area agencies on aging or their disability services advisory councils. They regularly have meetings, and with those meetings come packets of information. I'm not suggesting that you would have to present at those local levels, but I think the information is quite informative and probably valuable to inform the work of the members of those advisory councils.
Great. Yeah. Excellent point, John. And I think, always good to be able to share that information and get more viewpoints. And especially, I think, where there are these specialty sort of workflows or programs that the brokerages are working on that would probably impact those different councils and groups that you're talking about. So, all right, super great conversation. I think that as TAC members have additional ideas or questions about sort of ways that improvements or tracking of call center information might be possible, to shoot those over to our TAC group, to me, and we'll continue to collect those, and then we can talk about more via email, and then we can talk about more sort of how we get those, how we memorialize those and get those over to OHA in a formal fashion. So, George, I'll come to you in just a second, if it's okay. I want to make sure there's a couple things that we need to take care of. So I want to take us back. There were a couple of members that I was expecting and hoping were going to be able to join for this conversation, but I still don't see them. So I wanted to make sure that we get this recommendations paper sort of finalized if we can. So over the past few months and really beyond that, you all as TAC members have been making recommendations on language access and no-shows. We've had multiple conversations during our TAC meetings about no-shows in particular. And so over the past couple of months, we've been putting together sort of a formal recommendations paper to share with OHA. I think we have a final version. We had a near final version, I think, a couple of weeks ago. There were a few comments and suggestions for improvement. I shared those out with all of the TAC members. And then in your meeting materials, we had the final draft of that memo that would go to OHA. So I think we're there, but if there's anybody any of our tech members who think we aren't, or wants to share anything about that or ask any questions, then I wanted to give you space to do that. If not, that's great. If so, that's great as well, obviously. But if we are able to finalize this, then I will get this over to OHA on your behalf. So anything that any of the tech members want to talk about as far as content or additional changes that you think may need to be made to that document, or are we good to go?
This is John. I think I'm good to go.
Okay, great. Thank you, John. And I'm not seeing, make sure I'm not seeing anything from anyone. So I think it sounds like we are good to go. Let's see here. Okay, super. All right, so let's see. George, did you have an additional comment or a question?
Yeah, on the thing that you gave us.
Yes.
What did it mean that the safety priority, they ensure that any tools or language access provided during transportation do not adhere or interfere with the driver's ability to safely transport the member? And safety should always be the priority.
Yeah, so excellent question. And this is one of the things that got added as part of that review process. So the idea here, and if others want to speak up, feel free to do so. But the idea here is really to say, language access is obviously important. You're in a different environment than you are when you're in sort of a healthcare provider office, where you can have an interpreter and use assistive devices, et cetera. Fairly easily, hopefully. The unique situation here is, your provider at this point is the driver, and they're driving as well. And so the idea here is just to make sure that there isn't any sort of requirements put on by OHA or others that would put the safety of the member and the driver and other people who are in the vehicle at risk. So that's the idea with that addition.
And
yeah,
George,
Charles.
This is Charles. Yeah, I actually added that. So just wanting to put a nod to, yes, communication, those access pieces are critical, but I wanted to make sure and point out that at the core of it, transportation providers need to safely transport members to and from where they need to go, and that just needs to be a call as their priority. So safety and getting members where they're supposed to go has to be the number one thing. Not that we're minimizing other things, but we can't interfere with their ability to safely transport members. That's all.
The reason why I brought that up, because I've been reading over that, and it seems to me that if a consumer is in the vehicle with the provider and they have an emergency and they're not allowed to say anything to the driver, like if they've got diabetes or they're having trouble trying to speak.
Yeah, it definitely doesn't mean that. It's just that we don't want to put requirements on drivers that would interfere with their ability to drive and or get help for a member, or to hear or get the information to make sure the member's safe. That's all. It definitely not saying members can't talk. It's just we want to make sure that safety of the member and that transportation process doesn't get interfered with by other processes. That's all.
Okay, so how does a deaf person communicate with the driver if they're not allowed to know sign language or how to interpret the sign language when they need something and they're in an emergency situation? You get what I'm saying?
Yes, but that again doesn't say that they can't or shouldn't. So for example, if someone who is using an assistive device, then it would be like a driver would need to pull over and go to a safe location before accessing that. Those type of things. So as technology moves forward and there's a lot of stuff going on, it's really easy to try to use a lot of tools that may interfere with the passenger safety and the driver safety. So the call out just is meant to focus on the fact that the driver and passenger safety shouldn't be interfered with by other processes unnecessarily. That's the point.
Then can I make a suggestion?
Certainly.
Please.
If a person is not allowed to talk to the driver and they have an emergency, they have a disability, if they're deaf, then can it be stated in this document before it goes out or be approved that the deaf person or a disability person has a right to communicate with the driver when they are in a situation, because that scares a person with a disability. When that's out there, there's saying, well, God, I have a deaf, how am I going to communicate with the driver if I can't say anything to the driver?
And I think, George, we can work on ways to make this more clear, but I don't think it's not the intent, as I understand it, and the way that the paper's written now, that the person can't communicate with the driver. It's just sort of calling out that if there is like an assistive device or some sort of language access tool that would put safety at risk, that needs to be taken into consideration, and some policies and procedures developed around those types of things. So I didn't hear anyone say that the intent is that the member can't communicate with the driver, and I don't think that's the intent of this. So if we need to add language to make sure that that's really clear, I think we can do that, and I think that all of the TAC members would likely agree with that.
Yeah, because if a deaf person sees that and they're handed that document, then they won't be so scared knowing, oh my God, am I going to get docked because I just communicated with the driver?
Okay. All right. So let's check in with other TAC members to see if there's other comments about this, how you're feeling about adding some sort of statement to make sure that it's clear that that's not the intent, one. And then if you have suggestions for what language we might use to communicate that would also be really helpful. If not, I can work on that and send that out to you all. So
I'm not trying to make hard thing about this, Charles. I just, it scares a person with a disability.
So yeah, just note this isn't a document going to passengers. This is a recommendation document going to OHA around how they see and implement policies. It's kind of impossible for us to think of every potential individual circumstance. So trying to call out everything really isn't practical. The intent was just that safety needs to be considered, as is anything else, such as we have policies around don't go gas up your vehicle with a member in the car. That's just a simple safe, those type of things. So this is a recommendation document going to OHA on how they should implement and see things. So this document is not going directly to passengers, consumers, anything like that. So,
okay.
but George, I completely understand that. the goal isn't to silence anyone, scare anyone. It's to protect member safety and driver safety. That's all.
I understand that.
Okay. So if that sounds okay to TAC members for I'll develop some initial language. I think it can be fairly simple to add to that safety priority statement about this, just to add some clarity that this isn't limiting the ability of the member to be able to communicate with the driver. That's not the intent. I'll get that sent out to you in the next day or two, and then if we could have some sort of quick feedback via email, maybe within a few days, then I think we can finalize and get this sent over. Does that sound okay to everyone, or is there some alternative strategies to getting the document finalized that you'd like to consider here?
That's the only one. That's the only one I know. But I'm still reading all the way up to the bottom.
Okay. All right, I will get that out to you then. Probably just like a sentence or so added to that safety priority statement, and I'll get that out via email, and then we can have that conversation amongst the TAC members. All right. Yeah, go ahead, George.
Sorry to interrupt, but there was a person in here that had their hand up. I saw their hand go up.
So I don't see any hands up now. So I think I saw John had his hand up for a little bit. I think he's good now. And I think Shannon put her hand up just to say, yes, that she agreed. So okay. I think we're good. But certainly if folks have TAC members have something else that they need, just go ahead and put your hand up and we'll get to you. All right, so we're going to move to our next topic. We're running a little behind, so I want to make sure that we have some opportunity to kind of see what we're talking about here and do some brainstorming and provide some feedback on things that you think are helpful or not helpful. So to kind of set the stage here for what we're talking about, this is around OHP member informing materials. And really what that means is the things that are published or put out to help members understand the non-emergency medical transportation, what it is, who's eligible for it, how you access it, what to do if you have problems and questions, et And so the typical sort of things that members have that provide information about this is sort of their member handbooks. So the overall member handbooks often have a little bit of information about NEMT. Rider guides have lots of information. These are typically like either printed or available electronically with lots of information about how to do all those things that I just mentioned related to NEMT. There's websites that again can have some additional information or different ways to access that same information. Less sort of common, and this is sort of where I think the meat of our conversation will be, are sort of these alternative formats. So like videos or trainings, and those might be online training, they might be in-person training, there could be a variety of things. And so members have expressed some interest in talking about this for a while and looking at, are there alternative ways to be able to communicate information that can sometimes be complex, might be overwhelming to some members, hard to understand. And so, and people have different ways of sort of learning and understanding information. So the idea here is to look at a few, and I think Rachel's going to help guide us through a couple, probably aren't going to have time, Rachel, to get to sort of all of the things you had identified. So if you want to like give us, 2 or 3 to sort of get this conversation going, I think that would be good. So they're going to give some examples of sort of alternative ways that that folks have put together information to share with members, and then we can on the backside of that, we can have some information, or actually, this hopefully can be sort of a discussion, but we can have some discussion towards the end here about, what works with those things, what doesn't, what else would you like to see? So Rachel, you want to go ahead and get us going?
Absolutely. So I created a small slide deck to kind of express some of those different options. So I do want to speak to one in particular because I was involved in supporting creating this video. And I also see that Jen might next to her too, not to put her on the spot, but if there's anything she wants to add about some of the work that we did to complete this, I welcome her to add any additions as well. So I chose this particular because, again, as David mentioned, there is a lot of information that's provided out there that's kind of a wall of text, to say the least, or a handbook that's pretty long or a guide that's pretty long. So it's nice to have options like this video, which I will play for us because it was pretty short, that really helps understand the NEMT benefit in hopefully a more digestible way. So with that, share. Oh, double checked and did some technical work ahead of time that I can do so with sound. So you can actually hear what's being talked about in here too. All right, everyone can see my screen?
Yeah, we've got it.
One of the most important parts of your healthcare is getting to that care. That's why your Oregon Health Plan benefits include transportation assistance for many healthcare trips. It's called Non-Emergency Medical Transportation, or NEMT, and it can take you where you need to go at no cost to you. You can use NEMT for different types of trips, including covered medical, dental, and mental health care appointments, substance use treatment, and trips to the pharmacy. You can schedule a trip as soon as you have a date for your appointment, or pre-schedule trips up to 90 days in advance. If you need help with language interpretation, just tell the operator when you call. There are 3 types of ride assistance available: mileage reimbursement, public transit, and vehicle-provided rides. Mileage reimbursement makes sense for people who have their own vehicle or someone who regularly drives them to appointments. Just call the NEMT call center before your first trip to get pre-approved and to determine the distance of your trip. After your appointment, you'll receive a Visa debit card. Once you activate your card, it will be loaded with funds that reimburse you for your trip on a per-mile basis. From then on, call NEMT each time you have an upcoming appointment. After each appointment, your card will be loaded with funds based on the distance. If you live close to public transit routes, call the NEMT call center as soon as an appointment is scheduled to request passes. You can also get free transit passes to your covered appointments. They'll determine whether a day pass or monthly pass is right for you. Transit passes give you the flexibility to go to healthcare and non-medical locations. If you don't have a vehicle and can't take public transit, you may be eligible for vehicle-provided rides, in which a private or shared vehicle picks you up. Call your NEMT program at least 2 days in advance and up to 90 days before your trip. They'll need to know your address, destination, whether a personal attendant or service animal will accompany you, if you have a mobility device, and more. The representative will help you schedule a pickup time from your home and from your provider's office after your appointment. Please note that it's not always possible for a child to ride with you. If it's a child 12 years or younger who needs transport, an adult or guardian must accompany them. Make sure you're ready to go before your vehicle arrives, and please be courteous to your driver and any fellow passengers. There's a lot more to know about the benefits of NEMT. If you live in the Portland metro area and think you may be eligible, call Ride to Care at 855-321-4899 or visit ridetocare.com.
Oops. Y'all don't need to see that a second time. So let me bring back my PowerPoint. So what I want to do, thanks John, is call out a little bit of information in regards to why some of the things were shared the way they were in that video and the development of what we included. So one of the biggest things I remember discussing was deciding on animation versus having live actors, editing videos and trying to provide additional or updated information to folks. with live actors can definitely have a challenge, to say the least. It's a lot easier to make those edits when you have that animation to set in something before something, or adjust, say, how somebody accesses a bus pass, etc. So that was definitely one of the main things I remember discussing. We also make sure to show the different types of transport that is available for NEMT. It's often kind of assumed by most who don't have as much involvement with NEMT that it is just driver provided rides. So it was really important to us to make sure that we included those different levels or types of transport options and how and why those are accessible to folks when they are. And then I really also enjoyed the part where we include the scheduling details. That way it really sets up members and providers up for success when they are calling to make that first time trip, that they gather all those details ahead of time to be successful in that space. So those are kind of the three main calls I wanted to make that I noticed while we were watching this video again. I wanted to hear from you all if you all noticed any other specifics that were helpful and or supportive in this video. And what I'm going to do is I'm going to take some notes in the slide deck itself, and then I'll upload this page when I send it out to the group. Go ahead, George.
I like your presentation that you just presented. To do another level up is to have it in words where a deaf person can read it, or some type of sign language. Maybe a little one at the bottom or on the side.
Yeah, there is closed captioning options if so wanted to. They're just, I did not click on that to offer there. And then there's additional languages that you can choose as well if you scroll down there. But that's a great call out.
Another idea also too is that if for example, if the new manuals go out for consumers and there's a video on it, there could also be that caption too.
So for the writer guide, is that what you're thinking of having?
Yeah, it could be in paper form like normal, and then it could be also a video form. So if some that don't want to read it can see a video of the same thing. Just an idea.
Comments that were helpful in that video. I really like the animation personally, I like the style of it. The folks that came to us to develop this video had done one for Care Organs Care Coordination Team, which can also be found on their website, and just seems really bright and interesting and holds your attention. It's not too long, so we're not getting overloaded with information at the same time. Nice and capable. And I see that Jen put in the chat too that the videos for JCC and CPCCO and for business were created as well too.
This
go ahead,
is
John.
This is John. I am going to have to watch the video again to really give you good feedback. But
Sure thing.
I did think that it was a great tool. I am very happy to see that. I can think of a lot of places that it would be very helpful to share this video. So thank you for that.
I agree. I'd probably have to watch it and then just kind of see, where there might be opportunities to add or explain. But I think they're really well put together. Great job.
There was a lot of information crammed into it. So if we who know a little bit about NEMT are struggling to digest it, I'm thinking that the user is going to have as much difficulty.
Maybe slowing down the speed of which information is coming in.
That probably would be helpful.
George, do you still have another comment or question or thought? I mean, George, that was a question. If you just make sure.
It's not letting me put my hand down.
Oh, no. Well, I'll make sure to know that, and then feel free to unmute when you do have a question.
There you go, George.
Thanks, David. All right, so my next slide here are some, oh, and Danny, the video is linked above by David, and then Jen included the links to the JCC and CPCC versions right above that question.
And then Rachel, in your slide deck here, when this is put online, does it have the link to the video as well? Perfect.
Yep.
Great.
Everything that you see in this kind of lighter blue color, you can actually click to it. If it's a live presentation, it will go to those links that are listed.
And there's one for the video as well.
Correct. Yeah.
Okay. Gotcha. Cool. Yeah.
Hover over
perfect.
this one, you'll see it.
Okay. All right.
So these are some additional ones. I did some searching throughout to see what else I could identify as alternative formats beyond the writer guide or member handbook. So I'll pause real quickly. Tim, did you have a question?
Yeah, I just noticed I'm running the video for JCC and noticed that some of the captions may not be actually capturing the language correctly, where it says it's called non-emergent medical transportation, but then it interpreted it as EMT, not NEMT. So it just might be something just to kind of review, just so that there's no confusion, because yeah. But yeah, I still think it's a fantastic video.
That's a good call out for sure. And as mentioned, Jen is here, so probably can discuss a little bit with that, because again, this is Care Oregon's video, just to clarify, and not the Oregon Health Authorities. So
just a time check, Rachel. Maybe if maybe 2 or 3 more minutes, and then
sure.
we'll move to wrap up.
Yeah, absolutely. I wasn't going to necessarily click into each one of these, but if people are interested, I did discover a couple of what kind of is like a one-page flyer for different information through NEMT. So our Rideline brokerage has a couple of flyers regarding one for managed reimbursement and one for just the benefit overview. And I see Brittany, you got your hand up. Go ahead.
Yeah, thank you. Can you hear me?
Yeah. Mm-hmm.
I just wanted to call out those documents. So in relation to the CCO benefit, we actually roll up our provider guide into their IHN member handbook. So these are separate, so they wouldn't be all inclusive of what the CCO specifically offers. Rideline is unique in the sense that we also partner with a Medicare Advantage plan and a veteran plan. So the mileage reimbursement, I wanted to call it, is only specific to the CCO, but that one-page benefit overview flyer, if you're viewing it in the context of the CCO, may be confusing. So I just wanted to put that out there while others are reviewing the content.
Good call out, Brittany. Other in written format, there is a Pacific Source FAQ document that has some frequently asked questions. So again, it's something outside of that standard writer guide and or member handbook. Beyond the video I shared from Care Oregon for Ride to Care, I did find a Tennessee brokerage, which is this 10-pair NEMT benefit overview video. This is a live action one, so that was interesting to see. And then CMS actually has their own benefit overview, and I've seen no capitalization. Maybe I'll fix that before I send it out. But kind of gives that high level federal expectations for NEMT. And then there's a couple of things I wanted to mention that are not necessarily discussed in the NEMT benefit as a whole, but additional supports while using NEMT. Our Lane Transportation District has a portal tool, that you can utilize to schedule appointments. And so I wanted to show that. And there is a video that comes with it, just shows you how to use their portal. And then there is a link from Gogi, who has a NEMT social media toolkit, which is to help providers and clinics set up some information either online or you can print out some little flyers or like a little folded card that shows the information about in-transit district, or sorry, GOBI's information about NEMT. So some different variations of information, but again, trying to expand beyond just those writer guides and then the member handbook. So last space is just for any follow-up questions or needs, thoughts around, other ways to really improve upon getting information out to our member base about NEMT and how we support that.
So, and I think maybe I'll jump in here since we're very short on time, and I do think that it would be helpful, as several folks have mentioned, in terms of having a little time to digest. And so what I think we'll do, and Bambi, if you can take note of this, is we can capture this as an action item. So folks will be able to take a look at those resources that Rachel was able to find that have these sort of alternative formats. And what I would say is the biggest thing to pay attention to is not content, because the question that we're asking is sort of the format, and these different formats. Do you find these to be helpful? And if so, why? And if not, why? And then some of them are probably lend themselves to particular types of content better than other types of content. And so as you're looking at them, if you see something that's like, this would be really helpful, or this would have been helpful, a helpful way to sort of better understand a particular question that you had, and maybe the information was hard to put together. And so, maybe there's some one sheets on particular topic areas that sort of give you all of the most important information and FAQs and that sort of thing. So just be thinking about, to the extent that the content's helpful, then that's great. Some of those probably aren't going to be very applicable. Like Brittany talked about, it's not necessarily directed at NEMT. Some of them are from, not related to the Oregon program specifically. So the idea is this a good way, do you think, to communicate information, and would it be a good way to communicate to members some specific points about the NEMT benefit package? So, all right. So we have about a minute left. So I already made one note about, an action item. You'll see those come out shortly, and we'll get the pieces, the slides and stuff out on our NEMT TAC website within a week or week and a half probably, and then you'll have access to those. So really great discussion. Really appreciate everyone's attention to this. I think we have more things to talk about in these areas, and we've got some action items, and we have some things to maybe push to future meetings. Our next meeting, July 17th, the topic areas that we have identified is around CCO reprocurement. So it's time to, and past time really, they're working on it already, looking at sort of, what does CCO 3.0 look like? And the conversation that we would be most interested in the TAC is like, are there additional things or expectations or benefits or those types of things around NEMT that might make sense for consideration in this new recontracting period. So, and then the other part is around the TNC pilot and progress and updates. And then our final meeting is scheduled for August 21st, where that's going to be more sort of an open conversation. And this is the piece that I want you all to start thinking about now. We'll talk about it a little more in July, and then hopefully have some good ideas and strategies moving forward when we meet in August. But the idea is, what happens next? So we're set to, our last meeting is August 21st. There aren't any future meetings on the calendar. Does that make sense to you? I think that, we could have a variety of things. We could just end the TAC. You could probably continue in a similar or identical fashion to what we've done over the past couple of years, or maybe there's some sort of evolution or transition that the TAC moves into, not doing nothing, but or disbanding or whatever, but looking at ways that the TAC might sort of evolve and provide, feedback and reactions and, whatever that might look like. So be thinking about, in your perfect world, where would this go next? Where would the TAC go next? And we'll talk about that, like I said, in July and August. So with that, we are out of time. So we'll go ahead and adjourn. And thanks again to all our presenters and for the great conversation amongst the TAC, and look forward to hearing from you all on the action items that we've talked about. We'll get you more specifics on those and seeing you all in July. Thanks.
Thank you. Have a good evening.
Thank you all.
You too. Thanks, everyone. Bye-bye.